Hello, my name is Narissa Bauer. I'm the lead author and co-developer of the TEACH program. I'll be talking to you about our research study, ADHD Group Visits Improve Parental Emotional Health and Perceptions of Child Behavior. This paper shares the results of our second randomized controlled trial of our family intervention called the TEACH program. TEACH stands for Tailoring Education for ADHD and Children's Health. It was developed for parents and their children with attention deficit hyperactivity disorder, or ADHD. Children with ADHD can have problems at home and school with their learning, behavior, or relationships with others. It can be overwhelming for families to receive the diagnosis of ADHD. Many questions are bound to arise, including whether the child needs medication, therapy, or tutoring. Families often struggle with knowing how to best treat ADHD. Currently in clinics, it's hard for pediatricians to have enough time to answer these questions and provide support. And even if pediatricians recommend parenting or child behavioral therapy, there are many reasons why families ultimately do not connect to these services. And that's why we developed TEACH. We believe when given knowledge and skills, parents and children can learn to manage ADHD, and they have positive experiences with one another. And why not begin offering this where families are comfortable, at the pediatrician's office? TEACH has a strong emphasis on fostering positive parenting techniques within ADHD care as well as during everyday parent-child interactions. Clinics offering TEACH invite a small group of families to come to a 90-minute group visit. Parents and children participate in separate groups led by trained facilitators. Facilitators are members of the medical team, such as pediatricians, nurse practitioners, or social workers. In this study, we compared the outcomes of families receiving ADHD follow-up care as TEACH versus individual visits. It should be noted that in non-TEACH clinics, providers did get reminders about ADHD guidelines, but this system had been in place long before the study. Subjects were assigned to receive the TEACH program or usual care based on the clinic they attended. A total of 6 clinics were involved, with 2 offering TEACH and 4 offering care as usual. One TEACH clinic served a large proportion of Spanish-speaking families and thus offered groups in English and Spanish. A total of 91 subjects from 84 families were recruited into the study. Children were between 6 to 12, with the mean age being 9 years. A majority of these children were male. Over 2/3 of the children were on medication at the time of enrollment. Outcomes we were interested in measuring included the number of ADHD follow-up visits attended over the study period, improvement in ADHD symptoms and child functioning at home, as well as quality of life. Data was collected at the time of enrollment and 12 months later. Over the course of the study, though, 18 families withdrew or were lost to follow-up. So here's what we found. TEACH families attended more visits to the clinic over 12 months compared to families in non-TEACH clinics. This finding is similar to our past studies of TEACH, where we found that once families understood how TEACH works, they enjoyed coming to the visits. Also, parents reported a significant improvement in child's functioning at home. This was also found in a previous study published of TEACH. Compared to non-TEACH parents, TEACH parents reported improved emotional health over time. They also reported a greater decrease in challenges related to misbehavior, more time for themselves, other siblings, and routine household activities. However, children receiving care in non-TEACH clinics reported a significant drop in their own emotional health compared to children in TEACH clinics. There were no other differences in outcomes. In summary, families participating in TEACH experienced multiple improvements related to family functioning and attended more follow-up visits to the clinic. These findings support the need for future studies of TEACH with more clinics and more families. I invite you to contact me if you'd like to learn more about the TEACH program, as well as to read the paper in the Journal of Developmental and Behavioral Pediatrics.